So today I'm going to be assessing my 1-day postpartum patient. So I'm going to start off with co-wipe. I'm going to check my physician's orders, check my allergies. I'm going to assemble my equipment and assess my patient. I will wash my hands. I'll introduce myself and identify my patient. I will provide for privacy, educate, evaluate, and explain. So first I'm going to start off by taking my patient's vital signs. I'm assessing lung sounds and bowel sounds as well during this time. Then I'm going to have my patient go and void for me before we start her assessment. So we use the acronym BUBBLE. So doing that, first I'm checking my patient's breast. I'm going to ask her, does she have any tenderness? Has she noticed one of the breasts being larger than the other, indicating engorgement? Is she lactating? Is there latching on with the infant? Is there pain with breastfeeding if the mom has chosen to breastfeed? So then I'm going to assess her uterus. So when doing this, you want to make sure you support the lower, right above the pubis. And I should be palpating 1 centimeter above the umbilicus. And when I'm doing this, I'm assessing the size and the location of the fundus. And I'm also assessing, is it firm or boggy? And at this point, it should be firm. And if not, I would take my hand and then I would gently massage till it becomes firm. So now that I've assessed the uterus, I'm going to go ahead and assess my patient's bladder. Is it distended? Did she have a Foley catheter? When was the last time she voided? Then I will assess my patient's bowel sounds, along with, has she had a bowel movement? Is she constipated? From there, we go to looking at lochia. What color lochia is she having? How many peripads is she going through? What's the color? Is there an odor? Then we are going to evaluate the peritoneum area. Does my patient have an episiotomy? Was there lacerations? Do I see a hemorrhage? Do I see, not a hemorrhage, a hematoma? Am I seeing any infection, any foul odors? I'm measuring the size of that. And then I'm also going to ask how my patient's performing her pericare. Are we doing it correctly? And if not, let's educate so we don't get an infection. So then I'm assessing my patient's legs. I'm assessing my patient's legs. Is there any redness, pain, edema? And if there was an affected leg for a blood clot, I would be measuring the circumference of that edema. I'm also going to assess my patient's energy levels. I'm also assessing her emotional levels. What's my patient eating? Is she getting any sleep? Is mom sad, happy, crying? Is she involved with baby? Are we seeing that eye-to-eye contact? Is mom holding baby? Is she initiating holding baby? Things like that. And then I would document all my findings.